Hello Vladimir, nice to meet you. Thank you for coming here. You read about 4,000 studies now around laser therapy. What are your first impressions?
So I was very surprised by the large amount of studies published, because when I started my project of collecting photobiomodulation studies, the spreadsheet, I thought that maybe it's gonna be 2,000, the total amount, but it's about 4,000, so it's a lot, and it's from 69 different countries.
69 different countries, yes. Well, I'm from Germany. In Germany, laser therapy is not very common, just in dentistry. How comes that there is so a lot of published papers, but the user frequency is not so very high?
I think one reason is because scientists think it might be some pseudoscience, so they raise the bar a little bit higher, so you need like even better research than for drugs, for example. That could be one reason.
To get easier in touch with the scene, because drugs is a little bit more common.
And and the drug mechanisms might be like easier to investigate. In my country, Finland, it's the same thing, that for 20 years nobody has been studying photobiomodulation, but now there are 2 or 3 research groups that have started their projects, and they are gonna do clinical trials.
Great. What is the issue of these trials?
One group is gonna study oral mucositis in cancer patients, and one is probably gonna study like orofacial pain, and one maybe recovery from traumatic brain injury.
Yeah.
But there could be something else too in my country. Maybe I don't know everybody who is starting studies on this topic.
Vladimir, you have so a huge overview. Can you explain, is there a target for prevention medicines, the combination prevention medicine and laser therapy?
Basically, we could think it in through this narrative. So many chronic diseases, they have similar mechanisms. During the last 5 years in scientific community, they started talking a lot about, for example, inflammaging. That is
silent inflammation.
Yeah, low-level inflammation that is systemic and in many tissues, and also mitochondrial dysfunction. And animal data from laser therapy and photobiomodulation shows that like red light and near-infrared light could potentially target both low-level inflammation and mitochondrial dysfunction, and so it could be like preventive for like many diseases. But unfortunately, many studies have been like focusing on treatment of diseases and not prevention. So I guess we have to wait a couple of more years to see if there will be more prevention trials.
I think the themes like immunology and laser therapy, there are not so many studies we can read. Why?
Immunology, I think there have been like studies, especially in vitro, where they irradiate different immune cells. And then in animals, for example, we have this Gerianne Lyons doing research on multiple sclerosis. She's an immunologist, like researcher of immunology, and it seems like positive. But I guess there are also many fields of like within immunology that have not been studied yet, but I guess there will be more, because nowadays there are like approximately 400 new papers on photobiomodulation each year, and it's like growing. So I guess at some point the other researchers of immunology will get interested about this, maybe within 2, 3, 4, 5 years, and then we can read that data too.
Describing the inflammation pathway, you can get some crossover to immunology and to the systems of detoxification. I think these are the themes we could think about in laser therapy to go further in prevention medicine.
I think so. And one thing I've been really interested in has been that PBM, photobiomodulation. I use this new term because in the past we talked about low-level laser therapy, but 2 years ago they decided that it's better to talk about photobiomodulation because also, for example, LEDs, light-emitting diodes, they also have had positive effects. So it has been studied in animals to more than 100 different indications that are like heart disease, kidney disease, brain disease, skin disease, bone and muscle disease, very like almost every organ system, lungs also. So I guess that people will start becoming interested about like how red light and near infrared light could improve the general health, because basically it could target every part of the body.
I think you are dentists, we both are dentists, so we can say about 80% of the chronic diseases have an impact to the oral cavity. What do you think that we can start with all this therapy first in the oral cavity to be a service provider for the physical therapies?
Do you mean like there is this connection between oral health and systemic health?
Mouse-body connections.
Yeah. Oh, it's so difficult, like research field. I've been studying that a little bit because I made my dental thesis about endotoxemia and periodontal bacteria in patients who have had a heart attack.
Heart attack, okay.
But we know that oral health is very like connected to systemic health, and there are many potential pathways, but it's still like there's so much to learn more. So I can say that if you treat mouth, and the PBM can be beneficial for that, because photobiomodulation has been also studied for many oral diseases. It has been in dentistry. There are studies on, for example, tooth extractions, orthodontic treatments, periodontitis treatments, oral mucosal treatments, for example, this cancer treatment related oral mucositis, and what else? Probably there are burning mouth syndrome and everything. So I guess it's probable that it can have many positive effects on mouth, and better health in mouth could translate to better health in body, but we need more data, I would say.
Yes. What's the database of laser therapy and the microbiota of the oral cavity?
Microbiota of the oral cavity, I don't really remember the studies, because very often periodontological researchers, they are also interested about the bacteria.
Specified of the pocket, yeah.
Yeah, and I believe there is probably research on that topic, like studies investigating this periodontal bacteria, but I don't remember any, so I cannot promise that there you can find, because most often they are looking at the like outcomes like periodontal pocket probing depth and such, like clinical markers.
Yeah. The normal laser therapy started with acupuncture therapy. In the oral cavity we have a lot of meridian points. What is the database about oral acupuncture?
I don't really know about that, because I have this background that I don't know much about acupuncture, And laser acupuncture is like one part of the photobiomodulation research, but it's pretty small one. So I see those studies sometimes, but I don't remember many. I guess some of them have had good results. Some of them have had like modest or like neutral results, but I don't really remember specifically those.
It's very funny that these themes are quite separate. Just even some knowledge about the meridians in the oral cavity is not very well known, for example, in China. So it's very funny that the oral cavity is a cave not very well known in the physical therapies. So what do you think? What could we dentists do to get a better connection between the interdisciplinary workflow?
That's the issue, because in many sciences people have very like small focus, and there should be more communication between all of the researchers and the whole picture. I guess that's a really job for the scientists. Like, for example, I consider myself a scientist because I've started to write papers with scientists recently, and we have to do something so that clinicians will be able to see the whole picture and learn about things in an easy way. Now it's somewhat difficult. You have to look for the papers and reviews and hope that they give you a good overall summary of the topics. So that's the future issue to address.
You are the next generation of dentists. And what do you think, what are your ideas to involve laser therapy for normal therapy in the study program at the university?
I guess that like now, for example, my university, University of Helsinki, it doesn't really provide any knowledge about lasers and light in dental treatments, but it could be good to introduce it a little bit at least, because there is a lot of potential in like many different indications in the mouth. And there are like increasing amount of reports that it could be beneficial. Even in my country, we have a dentist organization called Apollonia, and yeah, and it has one like inside that organization we have this group of dentists who are especially interested in lasers, and we have meetings like 2 or 3 times every year. But it should grow a little bit, I think.
In this Apollonia Society, it's complementary treatments also with other stuff?
I'm not sure. I guess very little complementary treatments. It's
mostly laser therapy.
Like I mean like Apollonia, it's for all of the dentists in Finland. But it has these like groups inside that organization that have their own meetings, and this laser group, it's like this laser organization within Apollonia. We have meetings, but it's mostly about like laser in surgery, like dental surgery, and biostimulation by lasers.
Great. Yes. What do you think is the next step? What should we do as the next step to integrate the practical normality of laser treatment?
I guess more research will do it. Because mainstream medical community, it wants the evidence-based data. So when we can provide that, they will be more satisfied. And we need more research on the basic mechanisms. But of course, like for example, now we are at the conference for photobiomodulation research. It's bigger than ever before. More like people participating, so the community is getting bigger, and so the word will spread out to like many more places now.
Yes, I think laser therapy is a future, is a possibility, just to prevent problems in our healthcare systems, because these therapies very, very cheap, just even doing it.
Yeah, like electricity is cheap,
Cheap.
so light is a cheap drug. Of course, I hope the prices for the devices will decline a little bit because some of them are expensive. But otherwise, like it's very cheap to use.
To use. You have such an overview over the database. What are the mainly risks of laser therapy?
It's hard to say because there are so few side effects reported. It seems very safe. Basically, when you use too high doses, you can get inhibition of some biological processes. So if you use too much light, it could be harmful in some ways. Maybe it could slow down some healing or something. But if you use it properly, there was one paper showing that it can decrease the effectiveness of dental anesthesia. I don't remember the reason, but maybe blood flow. Yeah, maybe it will go away because of increased blood flow.
Yeah, because NO is losing, and that's why.
Yeah, but basically the safety profile has been pretty good, I think. And if there will be harms, I guess people will hear about that. Our community is very interested about both the positive and negative effects.
Yes, I think we should start to recognize how could we integrate laser therapy easier in universities. What would be, in your opinion, the first step to integrate this therapy in universities?
I guess it's good to communicate with the professors and university personnel. If they haven't heard about photobiomodulation yet, maybe it's good to discuss with them, and if they become convinced, that's a good starting point.
Yes. Then we have to start.
Yeah, it's about communication.
Thank you very much for conversation, and I hope we will see us next year.
Yeah, thank you.
Thank you.